Palliative care is a new term for many people. For those with serious, life-threatening medical issues, it's a welcome approach to caring for these complex cases. Dr. Elizabeth Weinstein has joined us in the UH Broadcast Center to explain this type of treatment. Dr. Weinstein is the Medical Director of Palliative Care and Cancer at University Hospitals. Welcome to the show here for us today. So what exactly is palliative care?
Palliative care is specialized medical care for people with serious illnesses, like you said. Palliative care aims to attend to the whole patient, so physical symptoms like pain and the stress of a serious illness. Palliative care tries to take care of not just the patient, but their family and loved ones. And to do all those things, we work in a multidisciplinary team. So we have doctors, nurses and nurse practitioners, social workers, chaplains, mental health specialists, to name some of them.
Wow, okay.
Palliative care is appropriate for people at any age and any stage of illness.
All right, so how is palliative care different from hospice care?
So that's a great question. We both have the same goals of attending to quality of life. Palliative care is a big group, of which hospice is a smaller component of it. Hospice has some regulations around it that deal with prognosis, and at this point in time in healthcare, people need to either not have options to treat their life-limiting illness, or they may choose to forego them, in which case they would be eligible for hospice care. We're both, though, palliative and hospice care, aiming to attend to the patient and their family and prioritize quality of life.
Okay. Is palliative care offered only in a hospital setting?
So, no. Palliative care is in hospitals, and some hospitals have specific places that they have a palliative care unit. Sometimes the team goes to the patient wherever they are, but palliative care also can be offered in the outpatient setting in people's homes, or if they live in assisted living or nursing home, so lots of places.
Okay. When is palliative care actually presented as an option? I know most people get into hospice too late, so is that the same kind of problems with palliative care?
So sometimes healthcare is just sort of figuring out how to provide palliative care, and institutions are at different stages of that. So the hope would be that it's offered early in the diagnosis of a life-limiting or serious illness. If you think it's something that's appropriate for you or your loved one and no one's talked about it, it would be fair to ask about it and try to advocate it for you or your loved one.
Now we know about it. So
Right.
what difference in patient quality of care have you seen with patients who are getting this palliative option?
So there's a nice body of evidence now to support the integration of palliative care, and it has shown that palliative care, when added to standard medical care, shows improvements in patient quality of life and satisfaction and caregiver satisfaction. And amazingly enough, when you talk to people about palliative care, they often would choose that path for themselves, and a happy side effect in a health system in crisis is that that doesn't tend to be the most expensive medical care. So it's also showing some cost savings.
Okay, excellent. Thank you so much for talking about this kind of a not new, but new to many people option.
Yeah, my pleasure.
When you have a team of healthcare professionals providing quality care across a variety of specialties, you have the result of improved quality of life for the patient and for their family. This makes it easy to understand the importance and effectiveness of palliative care. My thanks to Dr. Weinstein for sharing this information with us today.
Learn more by calling the Center for Lifelong Health at University Hospitals at 1-844-312-LIFE. That's 5433. Or visit their website, www.uhhospitals.org/lifelonghealth.